Are you guys on TikTok? I'm on TikTok, but not super active. I have to say though, people are doing a great job of putting out education on TikTok. So today, I'm gonna react to some educational and humorous TikTok videos. I'm Dr. Rena Malik, urologist and pelvic surgeon. Thank you for joining me. If you are new here, I do reaction videos to medical TV shows, and I talk about a number of urologic issues on my channel. If you like what you see, make sure you hit that subscribe button, and you can find me here every Monday at 9 a.m. Eastern Standard Time.
Yes. It's me again. And I'm back.
Okay guys, so that is one of my really good friends, Dr. Milhouse. She was my chief resident in residency. We are still very good friends. We actually did a video together before on reacting to complications, so make sure you check her out. But this is hilarious because we see in our subspecialty of female pelvic medicine and reconstructive surgery a lot of recurrent urinary tract infections. And they're horrible. While this is kind of a parody of how they show up, obviously, when you least want them to, when you're getting ready for the weekend, when you're ready to go do something fun, and they ruin your good, fun time, they are extremely bothersome. And a recurrent UTI is defined as 3 episodes of urinary tract infections within 12 months or 2 within 6 months. And they are usually symptoms such as pain with urination, pressure in the lower belly or suprapubic area, frequency, you're going to the bathroom more often than usual, urgency, having a strong, sudden desire to rush to the bathroom, and sometimes urinary incontinence or leakage of urine. You can also sometimes see blood in the urine with infections, but most commonly, the most bothersome symptom is pain with urination or burning pain with urination. It's also funny that she's wearing this like bright yellow jumpsuit because that's kind of the color that your urine gets. It gets kind of dark and concentrated, and it just doesn't look very good. And sometimes can look cloudy or smell funny, but those are not necessarily symptoms of UTI. So if you have cloudy urine, but you otherwise feel great, or your urine smells a little funny, but you otherwise feel great, you do not have a urinary tract infection, and you shouldn't get antibiotics for it because antibiotics can actually cause more problems down the line. So you can develop resistance to antibiotics and subsequently have a hard time getting the right antibiotics for an infection later on in your life when you finally do get a real urinary tract infection.
That's what I always do, and they never catch me. Ain't nobody gonna catch me.
Because you're too streetwise?
Yup.
This is funny because this is totally real. Like, as a physician, an attending physician, I never carry pens with me. Even if I have pens with me, I somehow tend to lose them or forget that they're in my bag, and I will ask anybody, whoever's around me, a nurse, a medical student, to borrow their pen. But I always give them back. But sometimes there are attendings who are notorious for taking your pen and not giving it back. So we often tell medical students, carry some pens that you don't really like, those cheap pens, so that you can give them to your attending when they ask for them, because you might not get them back.
And I'm swerving in the streets, got you nervous that I'm really lurking, murder on the beat. Been a burden, now I'm really working, ain't you finna see. You a servant, got your bitch, she working, twerking in the sheets. Yeah, hey, get the fuck out of my way.
Yeah, so this is completely accurate. Again, I love TikTok for disseminating education. In fact, I think I have to get on TikTok, although I've been resisting it because I think it's such an important way to educate people in a quick, short soundbite. So yes, absolutely. I see patients all the time who have recurrent UTIs but have never had a culture positive infection, and they actually have what's known as pelvic floor dysfunction, which means that their pelvic floor muscles, which are basically the bowl of muscles that sit at the bottom, very bottom of our body, that hold up all our organs, those muscles are too tight. It's like when people get TMJ and they're really stressed and they carry it in their jaw and they have headaches. It's very similar to that. You don't know that you have it. You don't even know that it's tense down there. You just feel stress and you carry it in your pelvic floor and your muscles are always tense. And that is not a good thing. It does not mean that you're gonna have more pleasurable intercourse. It doesn't mean that your partner's gonna enjoy it more. It just means that you're gonna have a whole host of problems. Like you may have recurrent symptoms, like you have to go to the bathroom a lot, pain when you urinate, pain with intercourse, constipation, a whole number of symptoms that can happen from pelvic floor dysfunction. So it's really important to get an exam when you're having recurrent infections, see if this might be a problem for you. And yes, absolutely, I refer 100% of my patients with pelvic floor dysfunction to pelvic floor physical therapy because that's what's going to help. They're going to teach you the exercises you need to do to learn how to relax that pelvic floor and help get your symptoms better.
I took the cake, yeah, yeah. All about cake, yeah, yeah. Can we relate? All about cake, yeah, yeah.
I took the cake. All about cake.
All right, well, I love dancing and I love this video because it really does tell you what's normal. A lot of people don't even know what normal is. So yes, you should be going to the bathroom every 3 to 4 hours during the course of a day. And that is completely normal. So if you're urinating up to 8 times a day, that is considered within normal limits. If you are urinating more than that, that is considered abnormal. Also, you should be able to sleep through the night if you are under 65 years of age. You shouldn't have to wake up at night. But if you're drinking a lot before bedtime, meaning you're drinking a ton of fluid or you're even drinking through the night, you're going to wake up at night. Above 65, waking up more than once is considered normal. Not to say that it's not bothersome, but it is considered normal. And most importantly, the most important thing that I saw on her slide was that sex should never be painful. It should never be painful. So please, if you're having pain with intercourse, talk to your doctors, talk to your gynecologist, talk to your urologist, because there may be things that we can do that can help you have pain-free intercourse and enjoy it, because that's what it's meant for. So right here, she's mentioning a lot of things that result in urgency urinary incontinence. So certainly bladder irritants or drinking things like alcohol, caffeine, spicy foods, acidic foods, artificial sweeteners, all those things can irritate your bladder. I made a whole video about bladder irritants if you're curious, so make sure you check it out. Also, the keyhole syndrome is totally real. I see it all the time. Patients are just about to get in the door and they get this strong urge, like they have to rush to the bathroom and they gotta run in to go to the bathroom. And there are a lot of different things that can cause overactive bladder, constipation, drinking way too much water or way too little water can cause overactive bladder, smoking, being overweight. All of these things can contribute to urgency. And yes, physical therapy is one of the treatments that's available for urgency or overactive bladder symptoms. And what they do is they teach you how to reconnect that brain-bladder connection. So I tell people who can't go to physical therapy to do what's called bladder training. And bladder training is when you feel the urge to rush to the bathroom. And most people, it's like a wave. So the urge comes, it's super, super strong, and that's when you run to the bathroom. But if you wait long enough, that urge will come down and then you can walk calmly to the bathroom. So what I tell people to do is wait till they get that urge, do some quick flicks or quick Kegel exercises where they pull up and in and distract themselves from the urge. Let the urge pass, and once the urge passes, you walk calmly to the bathroom, and that reconnects your bladder and brain to interpret normal signals of going to the bathroom and having less urgency. And that works for a good percentage of patients, specifically if you're not having a lot of leakage. If you are having a lot of leakage, you may want to try that at home at first, because otherwise you might have an accident while you're trying to do this training.
Mixed with that Galifianakis, la la la, whatever, la la la, it doesn't matter, la la la, oh well, la la la, we're going at it tonight, tonight, there's a party on.
So for all my South Asian audience, this will ring true for all of you. So for all of us, it is expected in the South Asian culture to be highly academic. So becoming a doctor, an engineer, a lawyer in our culture is almost expected and not necessarily rejoiced. But getting married or having children is a cause for celebration. Actually, this is also one of my friends, Dr. Sayana Gori. Check her out on Instagram. She is a wonderful human being and did start a health tech company and does a lot of great entrepreneurial work as well as being an ophthalmologist. So she is a good friend, confidant, and great human being all around. I have a story. So I obviously went to medical school, graduated medical school, became a urologist, did a fellowship, got a great job, did all these things. My parents were always proud, definitely proud. But when I made my first YouTube video on YouTube, everybody was like, wow, we're so proud of you. This is great. In fact, I went to a family party after starting YouTube and somebody came up to me and was like, wow, you're really making us look great. And I was like, like I did all these other things. I never heard this many accolades until I started a YouTube channel. So like I said, it's just expected that we're going to excel academically, but the other things we do sometimes are more exciting.
Coming at me, I wonder who does it. They can't see the vision, boy, they must be out of focus. That's a real hot album, homie. I wonder who wrote it. Oh, shit.
Whoa, that's awkward. So a vasectomy is a procedure that is done for male sterilization. And essentially, I talk a little bit about that in my reaction to Rhett and Link getting a vasectomy. Make sure you check that one out. But basically what it is we snip a small portion of the vas deferens, which carries the sperm into the semen so that you can no longer carry sperm into the semen and subsequently fertilize or get your partner pregnant. So usually after you've gotten your vasectomy, at about 3 months afterwards, you will get what's called a post-vasectomy semen analysis to make sure that there are no more sperm in the fluid that you ejaculate, and subsequently you are sterile. So if someone gets pregnant after a vasectomy, that's a bit suspect. However, it's not 100% effective. While it is upwards of 99% effective, because it is possible for the vasectomy to fail. Sometimes you can get the same vas twice instead of getting 2 separate vases, which happens very rarely, but it can happen. Or you can get something else that looks like a vas deferens that is not a vas deferens, and subsequently you haven't actually given the patient a vasectomy. Again, these are extremely rare, but these things do happen. Thank you guys so much for watching. I hope you enjoyed that. And if you did and you like what you saw, make sure you let me know if there's something you want to learn more about on my YouTube channel. I do make a list of everything you guys suggest me, and I try to make videos based on those suggestions. So thank you so much for being a part of this community. You guys make it all worthwhile for me, and I really appreciate you. Always remember to take care of yourself because you're worth it.